what's interesting is that it does work very well because I've done it on myself. All I did was a simple IV infusion. I don't know what I did to my hip, but it was like a persistent discomfort. And if I do a lotus position, right, meditation, then it really was stiff and can be painful. And I tried everything and it was still not getting better. And then I did an infusion of these mu cells. Within a week, I can't tell that hip was ever problematic. It's normal. It's just the same as my other hip. This is amazing. It's kind of caught me by surprise because I didn't even think about it. I didn't notice it until I tried to do certain things like the put my feet in lotus position. I was like, wow, I'm completely healed. This is incredible.
How long
Within
did
a
it
week.
take?
Within a week. It's absolutely mind-boggling. That's the kind of potential that we're looking at.
Incredible. And those are called Muse cells, right?
Yeah, MUSE.
All right. Well, it's a real pleasure to finally have Dr. Joy Kong on the show today. Welcome.
Yes, so good to see you, Zara. It's taken a long time.
It's taken a long time, back and forth, but we're finally like connected, and I'm super excited to learn more about stem cells today and everything you know. But you do so much in this world of aging, regenerative medicine. So I think we could go down any rabbit hole here. But first, why don't we understand why you got or how you even got started in this world of I hate the word anti-aging, so I'm just going to use regenerative medicine or things.
I love that word. I guess I bought into it when I first encountered it. Someone was telling me, "Oh, this doctor said, do you know about anti-aging medicine?" I was like, "No, what's that?" So that was about 10 years ago. So what kind of medicine is that? And then I got to learn what the principle was. So it's not so much about anti the number of age, it's anti the decline that comes with accumulation of numbers. So I love the idea of the anti-decline. So the aging has a connotation that there is a decline. There's going to be people are going to be weaker. They're going to be slower. They're going to cognition is going to be not as good, and then they're going to get more sick. So that's what aging is. So if you're anti-age, then you're anti all that. So I think is wonderful. And of course, there's so many things you can do to reduce the rate of aging, and that is really the entire spectrum of functional medicine or integrated medicine. It should be the entire spectrum of medicine, period. Of course, you want to know what happens, what you can do when a person gets sick, but there's so much you can do to prevent them from aging, and then you prevent them from getting sick at all. So people can gradually age. One day, I think that could be all changed, but at this point, at least you can get them to maybe get older in their numbers of age, but never get sick and still vibrant, walking, having fun with their friends until the day they fall asleep and never wake up. So that is what I think would be the ideal of how we should live our life. And it's very possible with the new way of doing medicine, which we're all into, and more doctors are getting into this. But it's still not mainstream. And it's sad that it's not, because the opposition is fierce. There's an existing system that's making a whole lot of money from people getting sick. So there's not much incentive to make sure that people don't get sick. So that's what we're facing right now.
So it's funny because, yeah, although I don't like the word anti-aging, I guess nobody's has a problem with anti-cancer or
Exactly.
anti-disease, or so I think the problem is that aging, when we say we're anti that, aging can be something amazing. Can get more wisdom or you have more experience. So there's some good things about aging, which is kind of like
I
we
see.
lump it all together.
Right, right. You must
Anti
have thought a
all
lot
parts
about
of
it
aging.
since you're a gerontologist. So you're all about what's going on with aging.
And the words, and I studied at USC. So in the US, everybody's like PC, and we can't call people older. Elders is like not acceptable, but older adults is like all this terminology.
It's
And
so silly because I came from Chinese culture, and the Chinese people, if you ask an older person how old are you? 85. They're so excited. They're really proud. And it is something you should be proud of Not many people make it there.
Yeah.
So every step of the way, you should be proud of how far you've gone. So it's unfortunate in this culture is valuing youth and not respecting wisdom as much. So hopefully people are going to learn.
Yeah.
They're going
And
to
you're
learn
right.
to,
I used to live in Hong Kong and I remember people were much more straightforward
yeah,
about things. And you're
it's
like,
that.
well, okay, it's just normal. Like it's part of life, right?
Why hide? Celebrate. That's why my age is very public.
How
That's
old
what
are
it is.
you?
I'm 54,
I'm
but
much
I want to
older than
show
you.
people, hey, yeah, you can accumulate age, but you don't have to decline. You don't have to decline in many ways. So, of course, I have a range of tools that I have, and I share all my tools with my patients and with everybody.
Okay, let's dive into some of those tools because in your podcast and I see in your clinic, you do talk a lot about red light therapy and peptides, hydrogen water, but you do focus a lot on stem cells. So why have you focused so much on that?
I've always loved shortcuts in life.
That's
It's
me.
something, right? So in my school, my goal is to use the minimum amount of time and effort to get an A. So that was my, and same thing with health. I want to do the least I can do, the easiest to get you the best results you can imagine. So stem cell therapy is the best shortcut I've ever seen. It's absolutely mind-blowing and incredible because it is using the intelligence of the design that made you and me. It's borrowing a piece of intelligence and then telling the body, this is how you do it. And your body would just follow the design and start to repair and become a newer and better version. So that is the ultimate. If you can tell the body to do that, stem cell therapy is not the only thing that can do it. I'm not arrogant enough to think that, oh, I have this tool, stem cell therapy. This is going to fix everything. We don't need to look at other energy forms, earthing and sunlight and vitamins and microbiome. I'm not saying that, but if you're looking at the biggest bang for your buck, this is just incredible because you can do something really simple and it is so elegant. I can just inject something into the veins of a person, and no matter where the problem is, it could be your hair, could be your lungs, it could be your muscles or pancreas, the cells will find their way to these places. And then they will send signals to tell the body to do things that are conducive to healing and to repair. And all of a sudden, so much problems go away, so much suffering go away. And that's what I see day in and day out in the clinic. I wouldn't be so passionate if I don't see the results in my patients. Then I'll just be talking theory. I have no interest in just talking theory. Theory, I think, is great, but the practical evidence and of actually making a difference in people's lives, that's what's driving me. I'm kind of like a crusader in a sense that I just keep talking about it because it's so exciting and it's fun. It's fun to make people better or preventing them from declining.
So let's explain a little bit what a stem cell is and what stem cell therapy actually looks like. Maybe give a visual what happens to somebody if they go into a clinic and say, I want stem cell therapy for my joint pain, for example.
Yeah. So stem cells is nothing mysterious. Is really not as esoteric as people think it is because literally you and I at one point was a single stem cell. So we were all a stem cell at one point, one single stem cell. That's the fertilized egg. So that fertilized egg has in it this magic that's packed into this coating that's wrapped in the DNA, right? It's embedded in the DNA. And
Can I ask you
DNA,
something like before I forget? Sorry to interrupt, but I heard that fertilized egg has the most mitochondria in it. Is that true?
I
More than the
don't know
brain,
that's
more
what
than a muscle, more than a heart.
I haven't come upon that particular piece of statistics, but I would imagine because you have to power lots of transformation and really you have to help power the manifestation of the magic, right? The
Yes.
magic's to make a human. So how
So
do you make a human from one cell? And,
yeah,
and that's the power that's in it. The DNA has the information and there's the sperm meets in the egg and there's a spark of light And there we have the start of a new life. And how does a cell know how to divide and how to make slightly different variations so that it will be able to make new structures and new forms and start to migrate to different places? How do they know where to go? All that is packed in the instructions that's in that fertilized egg. So from there, every time when it divides, each cell is basically a stem cell. They just keep dividing. It's a ball, literally a ball of stem cells. But when they divide, they will gain some kind of function. So they otherwise you just be ball of identical cells, right? That does nobody any good. So they have to differentiate and change a little bit. And as they change, they are still stem cells, but they are a little bit more evolved, right? They have getting closer to their mission. What's the mission? Is the final cell that's working in an organ. If you have liver, then the liver cell is the final destination. You have your brain and the neurons, and you have your eye retina cells. All these cells are destinations. Once it becomes a destination cell, a working cell, is no longer a stem cell. But every step along the way before it became the working cell is a stem cell. So when we talk about stem cells, people think it's one magical thing. No, they're like 1,000 degrees, shades of gray. It's really hard to say, oh, at this point is this type of stem cell. And then after whatever steps, but it's a continuous transformation. So the cells do transform into a more evolved form of a stem cell. And that stem cell would evolve into other kinds of stem cell until they get to the final working cell. So we can borrow any place along the way. We can borrow the stem cell and knowing where they're going, right? So we have, for example, ectoderm stem cells. So these are stem cells that are particular to a particular germal layer because there are 3 germal layers when we are forming the embryo. So the ectoderm is on the outside. That forms skin, hair, nervous system. So from that cell, if you can get cells from that early ectodermal stage before it becomes more differentiated, then you can use that cell to differentiate into anything in the ectodermal layer, right? Anywhere along the way you can do skin, hair, and the nervous system. But there are higher up, right? There are more primitive cells that can become ectoderm, endoderm, mesoderm. They can become all different germ layers. And these are the pluripotent stem cells. So these are higher up in their capabilities. Of course, the most potent is what we call embryonic stem cells. These cells can become any cells in the body, including the gametes, so the sperm and egg. So they can become anything. So you can grab one of those cells and form a whole organism. So you can intercept in any step along the way. So scientists are using different types. The type that we're using in the clinic the most often will be the mesenchymal stem cells, which are the most popular. These are coming from the mesoderm, but because they are in this particular germ layer, they are very much tied in with your circulation, with all your blood vessels. They hover around your blood vessels and waiting for signals in your body, whether or not it's locally or inside the blood vessels in the blood. They sense signals. They are tracking what's going on so that they can respond for your body to help you repair. So they're everywhere in your body. And these are really a type of signaling cells, but they are stem cells. They can also differentiate and become muscles, bone. They can even, or the earlier ones, this comes to the topic, not all mesenchymal stem cells are equal. Not all stem cells in the body are equal. If you get it from a young source, like the umbilical cord, compared to getting it from an adult, you're going to have much broader capabilities of differentiation, a much broader range of growth factors that they can secrete on top of a lot of other advantages. So just because there are mesenchymal stem cells coming from different places in the body and from a different age of the tissue, they're all different. So there's no uniform thing called stem cell. And that would be, and I still see that mistake made by even practitioners. I remember hearing a nurse practitioner talking about stem cells, talking about how magical they are, as if they're one thing. No, it's very complex, and there are many kinds of stem cells. And clinically, we also use a lot of cells from the cord blood. So umbilical cord blood has a lot of these primitive immune cells and also progenitor cells that can help form blood vessels or form the bloodline. So that's also very potent. We actually use both sources together synergistically. So it's really, you're harnessing different types of potentials when you bring all these cell types together, and they're all stem cells, but they're drastically different. But people can get stem cells from all kinds of places, like the dental pulp. You can get it from menstruation blood. There are a lot of stem cells there. You can get it from a person's own fat, bone marrow. Yeah, but really, anywhere we have a lot of stem cells in the body in different forms with different orientations. So that's kind of a long-winded answer of what stem cells are.
Oh, wow. Okay. So I've understood there's different types of stem cells and there's different levels and of where they are in the process of differentiating themselves,
Mm-hmm.
right? Like you said, the original stem cell is just from the egg, and then they have to grow into a blob, into a human, right? Or decide if they're going to be eyes or nose or skin or whatever. So you mentioned that you're using mesenchymal stem cells, which is somewhere down the ranks, but you said pluripotent stem cells, I think, were the least, or at least the first part of that chain of differentiation.
Very high up. Yeah, it's very close to the very top.
So why wouldn't you use those instead of mesenchymal?
You can, and there are different forms of these. The most famous pluripotent stem cells at this point is embryonic stem cells. Unfortunately, I mean, there are a little bit, there's still different degrees of pluripotency among stem cells, but they're a little harder to control. Embryonic stem cells sometimes can go haywire and start to form a cluster of uncontrollable growth of disorganized tissue. So then you get a tumor. And there are other forms of pluripotent stem cells that people have used. One is the induced pluripotent stem cells. You can use these Namayaka factors to change a working cell, and get them back into an embryonic state. So you would think, wow, this is the end all be all. Now we can get a first original cell from our skin cells. So that's the original experiment. Unfortunately, that they are not able to control these cells very well. So for whether or not it's the technology that reverted these cells because they use viral vectors, or just the nature of how the cells work, that these cells are having the same issues, causing new tumor formation. So it's a little harder to control. And there are other forms of pluripotency in cells. And one type of cells that we are starting to look into and actually provide the treatment for is Muse cells, Muse stem cells. So they have pluripotency. It's very fascinating. It's a subpopulation of mesenchymal stem cells. This just shows you the complexity of what's going on in the body. You think that mesenchymal stem cells are from this particular germ layer, but they actually have a subpopulation called Muse cells that can differentiate into just about anything in the body. And the way they differentiate is really fascinating. It's like a science fiction. What they do is that if they see a bad cell, a cell is not functioning well, they will eat it. And when it is digesting the cell, the DNA pieces are released, right? The cells are just falling apart. And those DNA pieces will trigger these cells to become that type of cell. So all of a sudden, now you can digest the bad cells and then become that tissue, right? You're making new tissue. So it's really remarkable. It's fascinating. So there's more and more more popularity because the Kardashians did it. What's interesting is that it does work very well because I've done it on myself. All I did was a simple IV infusion. I don't know what I did to my hip, but it was like a persistent discomfort. And if I do a lotus position, right, meditation, then it really was stiff and can be painful. And I tried everything and it was still not getting better. And then I did an infusion of these Muse cells. Within a week, I was like, what? I can't tell that hip was ever problematic. It was like, it's normal. It's just the same as my other hip. This is amazing. It's kind of caught me by surprise because I didn't even think about it. I didn't notice it until I tried to do certain things like the put my feet in lotus position. I was like, wow, I'm completely healed. This is incredible.
How long
Within
did
a
it
week.
take? Within a
Yeah, within a week. It's absolutely mind-boggling. That's the kind of potential that we're looking at.
incredible. And those are called Muse cells, right?
Yeah, MUSE. Yeah.
Oh, wow. So there's a whole other world out there. You mentioned germ layer. What's that?
So when an embryo is forming, it's forming into different sections. So there's the outer layer. So if you're looking at the ball of cells, the outer is the ectoderm on the outside, and the in the center is the endoderm, is in the middle, and then in between these two layers is the mesoderm. So it's just a way for the scientists to track what's going on with this ball of cells, right? You want to track, okay, the outer layer, what are they becoming in the middle? And again, it's a continuum, but us as humans, we have to be able to track different things. So they divide them into three different layers. And then you can see the cells that are on the outside, they're becoming certain tissue. The cells that are on the inside are becoming various internal organs. And the cells in the middle are becoming a lot of the muscles and bones and tendons, etc., and fat.
So how do these different cells, when you say you use a mesenchymal mesoderm cell, is this would you use those cells particularly for skin and then the Muse stem cells particularly for a joint issue? Are you using different?
No. The beauty about stem cells is that a lot of the stem cells, what they provide is signal, which makes it a lot simpler for the practitioners because we don't need to, oh, you have joint issues, so I need to give you cells that only can become joints. Actually, we don't need to do that at all. I can give you a bunch of cells that will just give you signals. And the signal is going to transmit and tell the joint stem cells to wake up. Because remember the lineage, the evolution of the stem cells all the way down to the working cell. So in all your tissues, there are stem cells that are ready to become the working cell. So they're the last stage of being a stem cell. And we have them in our tissue. The liver have these progenitor cells that are ready to become liver cells. But a lot of times when you're damaged or you're inflamed, when your system is in a state that's just lagging in its ability to repair, these cells will come in and give the signal to these precursor these stem cells that are their mission is to become a working cell. Now, instead of being stagnating and stunned into inaction, now they're woken up. It's like, hey, we need new cells. We need new working cells. Come on, give us some new cells. And then they can divide and give you new cells. So instead of trying to inject cells that can only become a particular type of cell, you can inject these cells like mesenchymal stem cells that will give signals to tell your local stem cells to become the new cell. So it's a very elegant way of allowing all these tissues in your body, right? You have just incredible variations of different types of tissues. It doesn't matter. I can give you one cell type that can trigger the regeneration of all these tissues.
Okay, so imagine somebody comes into your clinic and they've got knee osteoarthritis, they've got skin issues, and then some gut problem. How does that cell know where to go?
The cells respond to signals. So they are attracted by inflammation and injury. All these will send particular cytokines so that they will send out information into the local area, into the blood. So these cells, I was telling you the mesenchymal stem cells hovering around the blood vessels. So they are tracking what's going on in the blood. If they sense that there's these signals around, they can squeeze themselves into the blood vessels and start to swim upstream. I would say it's like a salmon tracking the origin. And then once they get to the concentration of the signal, the strongest concentration, that's when they can squeeze themselves out of the blood vessels and start to get to the place where they're needed. And then they can send their signals and start working. So they don't need to, yeah, they have a way of knowing where to go. This is why it's so fascinating. Just give you an example, just to make it a little bit more tangible and instead of just in theory. My very first stem cell patient was a 69-year-old gentleman with severe knee osteoarthritis. And he was told by two orthopedic surgeons that he absolutely needed bilateral knee replacement. But he's very active. He was going to lots of trade shows, and he just didn't want to go through basically
Well,
it's
surgery.
yeah, you're
It's not the
cutting
first
part
thing.
of your body and then replacing with something. So he didn't really want to do that. And of course the recuperation time is also very long. So he said, okay, let me try stem cells because there's no downside, right? There's no downtime and either it works or it doesn't work. So I inject it into both of his knees and I give him an IV infusion because you want to target the larger joints in both ways because the outer one third of a large joint like the knee is nourished by the blood supply. The inner two thirds of the cartilage is nourished by the synovial fluid. So if I want to make sure within the joint space that there's enough cells, I need to inject in right in there. But if I want to enhance not only the outer one third layer to regenerate, but also your whole body needs to repair. You are not repairing the osteoarthritis lingering because your whole body cannot mount a type of attack to get rid of the inflammation. So you need to repair your whole body as well. And that's what the IV infusion is for. But I had no idea that one of the first things he noticed was that he was able to sleep through the night. And that is because he's rotator cuff injury that he had 40 years ago that has never repaired kept waking him up in the middle of the night. When he switched around, move over, the sharp pain would wake him up. But since that day on, that pain was gone. That shoulder, I didn't even know about the rotator cuff injury. He never told me. I definitely didn't touch that shoulder. All I did was give the cells IV, but that shoulder is fixed after 40 years of pain. So that just gives you an idea. How did the cells know? I don't know. They know. So
And so they will. So if somebody is a hot mess and they've got three or four things going on, they tell you, would you give them
definitely
one
you want to
injection
use
or would you like, oh,
you,
wait, now I got to triple the dose because this is a,
yeah, the sicker you are, the more cells you tend to need. Just think about a person with multiple areas of problems, of all this inflammation, and giving people one batch of cells. The cells, let's say I have 1,000 soldiers, but then you've got 10 battlefields. Okay, so each one only gets about 100. Maybe one battlefield was encountered earlier, so 500 soldiers were in there, but the other ones, you only have 500 left, and you spread around the other ones. Good luck. But if you only have one problem, then all of the 1,000 soldiers can focus on that area. So sometimes I can't predict which area is going to get better because I'm not sure what the cells is going to find first. So the sicker you are, the more problem and inflamed areas you have, the more cells you tend to need. Also, the older you are, the more depleted your stem cell supply is. So I know you're a gerontologist, so it's very relevant because people are looking at all these factors of aging, but one factor is that you are running out of stem cells. And it's like a precipitous decline. It's like falling off a cliff. When you were born, every one in 10,000 cells is a mesenchymal stem cells. So stem cell. So that's the type of cell that are hovering around your blood vessels. But when you reach your teenage years, it's already become 1 in 100,000. So you got proportionally 1/10 of what you were able to do when you were younger. Because when we were young, babies, if they get a cut, it heals up very fast and there's no trace that there was a cut. But the older you are, the more sluggish the repair is. Why? Because you're just running out of these cells that can accelerate your healing. And when you reach your 40s, it becomes 1 in 400,000. So that's 1/4 of what you had when you were a teenager. And when you're in your 80s is 1 in 2 million. That's 1/5 of what you had when you were in your 40s. So you can see why older people, it's just so hard for them to repair. And that shows up in everything, including their face, right? They can't regenerate their skin cells anymore. Not very well. They can do some, but it cannot keep up. So any little damage, sun damage and mechanical damage, then it stays. It's not fully rejuvenated. So that's what happens. Yeah. So the age also is a factor as far as how many cells you need. And if you have a lot of problems, And for example, someone, let's say, has Parkinson's, another person with Lyme disease, and these are chronic, significant issues, COPD. To think that one wave of cells is going to cure everything, that will be expecting a miracle cure. And that's not what we're doing. Have I seen miracles? Yes. And I'm always pray for miracles, but it doesn't always happen. But what always happen almost, the percentage of patients that respond to therapy I've seen is about 90%. So we don't, it still is not 100%. I can't help 100% of people because sometimes there are factors that are just is really detrimental. There are some genetic issues that's I'm not able to fix with stem cell therapy that will resort to gene therapy. There are things that are toxin related. If you don't get rid of the toxins, it's very hard. There are things that are infections related, and that's going to be really hard. And if you don't address all the factors that are related to aging, including vitamins and nutrients, vitamins or other energetic issues, then things will always be dragging behind. It is not going to give you the kind of power to fully repair. So yeah, but for vast majority of patients, they do see really good results. But a lot of times it may take multiple sessions because you put the soldiers in the body and they fight your battles and they win some battles, but maybe not all of them. Or they win the battle to some level, but you need to finish up. You need to finish it out, right? Your war against the disease. So that would take multiple battles. So with one treatment, sometimes a person notices benefits, sometimes a person doesn't. But it doesn't mean that after the second treatment, you're not going to notice benefit because sometimes the disease process is not observable, that things may be changing, but you can't see it. Just like when people are getting sick, like coming down with a cold. It's not just like on Tuesday, all of a sudden you came down with a cold. The cold has been brewing for a whole week. You just didn't know about it. You couldn't sense it, but doesn't mean it's not happening. It's the same thing when you're trying to repair. So getting sick, sometimes it takes a certain threshold for people to realize, oh, I'm sick. The same thing with getting better, that you may be getting better, but you can't quite tell. So you want to give the body the chance with waves of repair.
So, in your clinical experience, then, what's the longest or how many times had someone had to get a treatment before they finally either felt something or saw improvement or actually cured the problem? And then what's the longest that somebody gave it a go, gave it a go, gave it a go, and then said, well, it's not working and they've given up?
My general, you have to make some kind of arbitrary decision when it comes to the timeline. But what I've seen is it's not uncommon for people to notice benefit months down the road, a few months, 2, 3 months, or even 5, 6 months. So it could take months. The three
That's just
sessions of
one, that's with one session, they may have to wait for 3 months. Is that what you're saying?
well, I usually recommend 1 to 2 months apart between sessions. So
Okay.
you want to catch the wave before the last one died down. You want to push another with a new wave. So I've seen people respond as fast as in within minutes of the treatment of pain, swelling going away. So it could happen really fast. I have somebody with dementia at the end of the treatment started speaking after the person had not spoken for a year. So it could happen fast, but that's not what I tell people that you can expect. Silently praying that this is going to be something dramatic and wonderful, but I don't give people that kind of expectation. I tell them, okay, if it's a neurological problem, it generally takes longer, and if this is inflammation related issues, then generally it can respond faster. But we're talking about tissue rebuilding. If you have damaged tissue, Rome is not built in one day. It takes time to make tissue, right? If you cut yourself, it's going to take time for your body to build so you can fill up the gap and cross connections and proteins. You need to give it a chance. In general, I would tell people, let's give the body the chance to see what it can do after 3 sessions. If after 3 sessions, which are 1 to 2 months apart, you see no response. Okay, maybe we're barking up the wrong tree. Maybe there are things that really need to be dealt with that are not addressed. Two biggest things will be toxicity, so underlying toxins or underlying infection. So we really need to take a deep dive. Usually those things can be quite involved. If you ever want to try to figure out whether or not you have parasites or have a toxic buildup, it's a lot of testing. You have to work with a good practitioner and really figure out what's going on in your body. So it's involved, but it may be necessary at that point.
Okay. So yeah, it's nice to have expectations. Say, go if after 3 goes, we're not moving the needle, then we got to go somewhere else so that people know. I don't know if you 5, 6, 7, maybe you'll have the result on the eighth session. I don't
No, I
know.
don't. I'm very conscious about making sure that people are not spending the money they don't need to spend. I always kind of err on the side of doing less because I'm always afraid that I'm going to make them spend too much money. I'm conscious of that. I don't want people to waste money. So yeah, I would say 3 rounds will give me a really good idea of how far we can push this. But if we're not moving the needle enough, let's look at all the causes.
So it's great that actually in your experience, you got 90% success rate. That's already huge. And I'm sure there's reasons for that, but
Yeah.
correct me if
When I
I'm.
say success, I'm not talking about complete reversal. There are cases that people have a reversal disease, being free of the condition. But there are a lot of times is improvement, right? Their quality of life, their inflammation level, their pain. A lot of things have improved. So that is, to me, that's a success.
Yeah, and I would count that as well. I've done platelet-rich plasma injections myself. I had hip osteoarthritis, and I was one of the successful ones in the sense that I thought I've seen improvement lasted around 1.5 years, more or less, and then I'd go get another injection. So it's still, even though ultimately I had to get hip replacements because it just stopped working, but they were working for a while. So I wouldn't say it a failure, but the research that I found, and you correct me if I'm wrong, in general, what research is showing that there's about a 60% success rate, which was similar to what I found with PRP and similar when I would recommend my friends to go see this doctor. It's like, he's great. It works. It was somewhere around 60%, maybe 70% of people feeling better, having results. But then there was like 30, 40 who were like, and that's kind of what was the research was showing for PRP, and the benefits in general last 6 to 12 months. And some studies are out there showing improvement lasting 2 to 5 years, which then you get more bang for your buck. Are these the stats that you're seeing just in general in the research too?
The benefits, the long term, I think there are a lot more studies on short term. The long term, definitely there are various research papers showing that even 10 years down the line or even 15, that people are still benefiting, are still doing well.
With one treatment, or do you think that they need? Because I
I
was
think
not even
some of
every
them
two
are,
years. I
most of the
need.
studies are based on a series of treatments, to be honest. Yeah, I think it's because of the potential for more complete repair that they want to make sure that people are getting several treatments. But that's several treatments within a few months time frame. And then they follow them for 10, 15 years. And oftentimes the people are still doing very well. Not all of them. There's one study was looking at autoimmune disease, and generally different research studies have different results, but around 12 months that people seem to need another treatment. But my question is, did you do everything you can do to make sure that you're removing the causes of these diseases? Because if you didn't, then yes, probably in 6, 12, or 18 months, they may need another treatment to promote the repair, because the same causes are still triggering the disease to happen again. This is why I always encourage patients to see an integrated doctor. That's why in our clinic, that's the type of doctors we have. We evaluate all the potential causes for the problems. So whether or not is your nutritional issues, your hormone imbalances, or toxicity, let's look at all the underlying causes. And yeah, I can give you something that's really amazing and with really quick benefits that can bring some transformation. But if you don't, then you're going to spend money again. You're back to close to where you were if you don't do anything different.
Yeah, when I asked my doctor who was helping me with the PRP, I said, "Why I'm successful, but yet other people aren't?" And the reason he said, "Well, because with PRP, you're taking your own blood." And he says, "If your blood is bad," and he would always measure the blood and look at a chart, and he says, "If the blood was bad, he wouldn't do the injection because you're using
Yeah.
blood
This
that's
is why
not.
I don't do PRP anymore. I used to do PRP. I used to mix it with stem cells. And what I realized is that the PRP, right, each person's different. Some people have really good PRP, some people have not very good. So the age is a big factor. Your health condition is a big factor. But even if you are a 20-year-old healthy person, I get PRP from your blood, it's going to be nowhere near as potent as what I can get from the umbilical cord. There's no comparison. The amount, the different types of growth factors, the amount of growth factors, and the lacking of inflammatory factors, it just blows the PRP completely out of the water. I don't use that anymore. So in our clinic, we use what's called the Chara matrix. So this is a matrix material from the umbilical cord tissue. So then you can utilize all that juice, right, from when the baby's forming and use that to inject into where I used to use PRP before. It could be a joint, it could be a face, it could be muscles. Yeah, I no longer use PRP.
Yeah, I was going to say that, so with PRP, you have to be really careful that you have really good blood, whereas stem cells, it doesn't matter because it's not
Yeah, and the
yours.
PRP can cause a lot of inflammation and also very painful. It's really interesting. Injecting a PRP, for example, I used to do that with hair restoration. Oh my God, that's yeah. People were swearing. Or you can use these birth tissue. It doesn't have the inflammatory type of signals to trigger that. So when we used to inject PRP into the knee, sometimes the knee blow up, the knee get an inflammatory reaction, but we don't get that with the birth tissue.
So then the question I have is, so a lot of people would be attracted to PRP because it's my blood. There's no one else's problems in there, even though they have problems. But the question some people would say with stem cells is, oh, I don't want someone else's DNA. Or some people mentioned the tumor growth, which I guess would happen more with the pluripotent tissue cells. But what are the risks? And is that true that we should be worried about someone else's DNA in our body?
Yeah, I actually made a YouTube video specifically about other people's DNA in my body. So I kind of joke around. I have so many people's DNA in my body and I love it. So I have been doing IV stem cells on myself for now about 4 years. Not 4 years, 10 years. So since, yeah, about 10 years. And every 3 months, I inject stem cells from somebody, right? Some baby that was born. So I've got probably 30, 40 people's DNA in my body just from injecting stem cells. First of all, the amount of cells that you're getting, really, we're giving you signals, right? That's what we're giving you. The amount of stem cells is so minuscule. It's like a little drop in the ocean of your body. But the signals are so powerful. And this little drop, most of the cells in that little drop will die within about 3 months. They're all going to go away. Maybe there's a few percentage that actually stays in your body, and I welcome them. It's been 10 years. It's been wonderful. So you are getting a blast of signals, potent from this little drop, and then most of what's in that drop will just disappear within 3 months. So the risk is really minuscule, or of having other people's DNA. But what I mentioned in my video is that the exchange of human DNA is actually a fact of life, that we've always had that throughout history till this day, because they realize that 60% of women actually have Y chromosomes in their body, right? And there's Y chromosomes has no business in a female's body. So why do females have Y chromosomes in their body? And they were trying to account for the possibilities. Was it because the woman had a male child that she didn't know about? Of course, if we already know females who have male children have Y chromosomes in their brain, their breast, and all their tissues. So we already know there's the DNA exchange when you have a baby. There's a huge circulation and exchange going on between the mothers and the baby in both ways. And so if you account for having had pregnancy of male children, or even pregnancies you didn't know about, that had a miscarriage that you didn't know about, or you're in the womb, maybe this woman was in the womb with a sibling, a male sibling, and then the male sibling died that no one knew about, right? There was DNA exchange in utero while you were brewing in your mom's belly. So they were trying to account for all these potentials, and they couldn't. And guess what the only conclusion was? And you probably can guess. It's between male and female intercourse. That exchange resulted in a huge percentage of these sperm, these Y chromosomes actually settling down in the woman's body and became part of the woman. So definitely be careful on who you go to bed with. If you want to have some cells, sometimes you may just get it. You may keep them. So this is a fact of life. This is what, that we know that already happens. So if you want to resist and you want to be scared, then maybe don't have any sex.
But with the stem cells, where are they coming from? And aren't you, even though we can't find everybody's DNA and account for it, but you do account for clean, or at least
Absolutely. Yeah,
sourcing
there's a
should
whole
be
process. So
checked
stem cell
out.
therapy is considered, type of stem cell therapy I do in the clinic is considered a tissue transplant. So it's kind of like a blood transfusion, right? Or even organ transplantation. We can, as doctors, we can transplant one person's heart into another person's body, right? These are called tissue transplantation. They're not a medicine. I'm not giving medicine. I'm practicing medicine. I'm not giving medications. So these cells are considered a transplant. And when you perform transplantation, these transplants have to go through certain regulations that you can't just grab one person's tissue and give it to another. There are rules, regulations, and screening involved. So American Association of Tissue Banks is the governing body for this whole tissue transplantation realm. And there are certain infectious diseases that have to be screened for. So including syphilis, HIV, and hepatitis. And so a whole range of infectious agents are going to be screened for. It's the same thing for stem cell therapy. So if I'm getting cells from extracting from a tissue, which is from the umbilical cord or anything. Unfortunately, if you're doing it from your own fat, right, from your own body, and you're transplanting back into your body, you're not screening for anything, and you're not even screening for contamination. So you're processing it and you're giving it back to the body. But when you get it from somebody else, there's a whole process. First of all, we screen the donors with very strict rules. So they can't have genetic diseases. We screen for anything that could affect the quality of this umbilical cord, which will be the mother's health, the mother's medical history, the family history, the sexual history, work history, toxic exposure, travel history, and the prenatal history. Everything is taken into account. And then there are different companies with different standards, of course. So what we use, we do not accept anybody with anything that's other than perfect. So we only accept this perfect donor that don't have any kind of risk factors. And once we get the tissue, and which we have to collect only from C-section. So cesarean section, planned cesarean section, not emergency C-section. So we want people are healthy and they plan to have a C-section, which means that we are going to collect the tissue from a surgical field, right? We're not going to allow the tissue to go through the vaginal canal. And if anyone has seen birth at all, everything is all coming together, and it's not a pretty sight, because you've got all the microbiome that's from different orifices all coming together. So it's very hard to ensure the sterility of the tissue. But when you do a C-section, it's a surgical field. So it's free of contaminations. And once the baby's born, the cord is cut, the placenta and the umbilical cord will be put into a normal saline bag and shipped over to the lab. And the lab will test for mother's infectious panel and also the tissue's infectious panel to make sure that there's no infection or infectious agents that are listed by the American Association of Tissue Banks. But the laboratory that I work with actually screens for more above and beyond, including Chagas, prion disease, COVID. So we screen for a lot more than what's required. And if the screening is positive for any of these bugs, the tissue is all trashed, right? We're not going to use it. But if everything is fine, the tissue is processed, after the cells were isolated and cryopreserved, then that final product is going to be sent to a outside third-party sterility testing facility. And that takes a few weeks for the tissue to come back, because they have to grow this sample you sent. They will thaw it out, and then plate them. And they would test for any kind of bacterial growth because this is to prevent contamination during the processing procedures. So only when that is shown to be completely free of any concerns, that's when there's a green light. Now you can give it to humans. So that's the process.
So let's talk about price because it's not cheap to do stem cells, as I understand. And especially if you do all these processes and maybe you want a higher grade and more screening, how much does it cost for treatment?
There's a range of cost depending on whether or not you're just getting a joint injection or you're getting an IV infusion or you're going to inject all over the body into different places, right? The more product you use, generally, the more expensive it gets. Either in the US or overseas, I think the price range is between $5,000 to $50,000. So it gets a little crazy, right? So it's a huge range. In our clinic, if you do an IV infusion, we start at $8,500. So that's the starting point. But the more product you use, which means the older you are, you may need more. The heavier you are, the bigger you are, that you may need more. And the sicker you are, you will need more. It goes a range. So we start at 2 cc's of stem cells and go all the way, generally, probably no more than 6 cc's. So 2 to 6 is where it's usually at. So it can go at our clinic, just using the cells could be as much as $18,000. So that's the kind of range, but that's just for IV. If you start to add more, because people want more, it's like, oh, this joint, I need this joint to be injected. And we try to make the price really reasonable and affordable as we can under the circumstance, because the products are expensive. And if a person wants, let's say, facial rejuvenation or hair restoration, okay, that's going to add up. If you want sexual wellness, we can inject the cells into the vagina, the penis. That's going to be extra. So it depends on how much people want.
Okay. So then my last question to you before I let you go, I have learned a little about exosomes. And then some people are saying, oh, that's old school. And they're talking about core cells. And some people would argue exosomes, well, there's no DNA and it's much cheaper. What are your thoughts on exosomes and core cells?
DNA is the powerhouse, is the intelligence that's behind everything. You want the DNA, you want some DNA. But you can do the exosomes. We actually use exosomes all the time at our clinic. We often use it as an adjunct. So what are the situations I use it for? If a person has a lot of inflammation, these batches exosomes, first of all, what are exosomes? They are secretion products from the stem cells. So they're collecting these signals from the stem cells. That's it. These are signals, molecules. But we can add all these signals into the body, and they're very anti-inflammatory. So we can reduce the inflammation very effectively along with the cells. And also, if a person has brain issues, these exosomes are nanoparticles. They will cross the blood-brain barrier with no issue. So better access to the brain. And also certain maybe topical procedures, like when we do hair, we can just do exosome, or face. We can do exosome facial or exosome hair restoration because they are so tiny that they go right across your skin barrier. But you can't do that with cells. You have to inject. The cells are too large. It's going to sit on top of your skin. So these are the few circumstances that I use exosomes, but I rarely use them alone unless it's for topical, etc., because I don't want to not give people the benefits of the stem cells, because the stem cells are what made the exosomes. So if you give people these live cells, the cells will stay in the body for about 1 to 3 months. During that process, it will keep making exosomes for you. So it's like you're just putting your body in this exosome factory. And it's not just exosomes that they secrete. They secrete larger extracellular vesicles that are way bigger than what can be packaged into the little nanoparticles of the exosomes, because exosomes is 50 to 200 microns in size, but the extracellular vesicles can be many times the size of these little exosomes, but they all have really important growth factors as well, signals. So you don't want to forgo the signals that's packaged in the bigger packages, right? Bigger little cellular bags. And then also, when you give cells, guess what's in the cells also? The mitochondria. So you can have fresh, new, healthy mitochondria actually not only powering the stem cells, but be released into another cell. So the cells actually conduct mitochondria transfer in different ways. But science have shown that a new cell can donate its own fresh new mitochondria to your existing cells, like macrophages, etc. They just take in these new, more vibrant mitochondria, and all of a sudden you're getting the mitochondria from a healthy newborn, right? So there's always a reset process when we have a newborn. So the mitochondria has been devoid of these damages that's associated with aging.
So then, okay, then the way it was explained to me is that exosomes do the same as stem cells. So why would you pay that much when you pay this? So that's not true, correct? You're laughing.
No, no. You're giving up part of the healing by focusing only on exosomes. And also, so this is why we all know exosomes has shorter benefits. So let's say the stem cells will give you benefit that lasts for 3 months, the exosome probably a month. That's generally the ratio. It's because the cells are still alive. It's still giving you more exosomes.
Okay. Well, we're going to have to talk about core cells next time because I'm going to have to let you go. That's a whole other thing. I will have links to how to find you. You got a great YouTube channel, Joy Kong MD, and I've got your website, Chara Health, and your memoir, actually, Tiger of Beijing. I have to read that one. That's super interesting. And of course, your podcast. Is there anywhere else that we should direct the audience if they want to know more about you?
Yeah, so I have a personal website as well. People can go to joykongmd.com if they want to learn everything that I do. So everything's in one place. But the YouTube is fantastic. I have a podcast as well, Dr. Joy Kong podcast, so people can listen to me. And the YouTube channel has so much information about stem cells or other forms of anti-aging treatments and the benefits. And then people can find me on Instagram as well, just Dr._Joy_Kong. That's Kong. So yeah, always fun little Instagram is fun because you have short reels that gives you snippets of useful information. So that's a fun place to follow as well.
And we didn't even dive into the stem cell cream, but you were telling me about this before we even started recording.
Oh yeah. So
Tell us, like,
I got my hands in so many things. So I did start a stem cell company, which I developed this stem cell product that is a combination of different types of cells. This is something that I'm very proud of. It's called Chara Core. And we've just seen incredible results, not only from my clinic, but also from all the doctors who are using this product. That's the combination of core blood cells and core tissue cells and embryonic membrane cells all in one. So you have different cell types. And yeah, it's a phenomenal product. After I was just providing these products for doctors to inject, I was looking for a good cream for my own face. So, and then I realized it's really hard to find a high quality, non-toxic cream. I mean, there's so much cream out, these serums and creams out there. But what I realized is that one, that they put a lot of things that really are not great for skin, may have long-term detrimental effects for our health, like hormone disruptions. And then two, they don't seem to be strong enough for regeneration. So then I thought, because I had such hard time spending all the money and still not finding anything good, then I got frustrated. And so I thought I'll just make it myself. Apparently they couldn't do it. People couldn't find it. So I decided to make something that's completely natural. So there's no toxic chemicals, nothing that could cause issues. Actually, they're all beneficial, including the preservatives. There's benefits. They're natural preservatives. And then on top of it, I added these peptides, which are very powerful. And then these stem cells that I've created. I didn't create it, God created it, but the stem cell, the juice, right? The juice with the cells. So I put them all together and created this product called Chara Omni. So Chara Omni. And that one has become very popular. And I just had a doctor who was sending me a text saying, I've used this post procedure, any facial procedure I'm doing. I put this thing on, the pain goes away right away. It's better than what is it he called? Zimmer chiller. Yeah, he's like, it's better than the machine I have at reducing pain. And these are the kind of comments people are making. And because it's potent. Yeah, it's got really powerful ingredients, but also mild in a sense that it doesn't cause potential problems.
yeah, I wish
So,
I had that for my scars. That would have been amazing. I didn't know.
yeah, I
But you must break down the stem cells that you put in there because you just said they're usually too big to get past.
Yeah, the cells are not alive. So I want to be very upfront with people that we're not putting the cells on your face and the cells are crawling around and being alive. That they're not. They are actually, the membrane has been broken. All their beneficial, like internal content has been leaked out, and that's what's really beneficial.
Ah, okay. So then it can cross through and do its magic.
Yes, yes.
So I will have a link to that, to sharaomni.com, in the show notes, and we have a discount code and everything. We'll put that as well. And so you can test it out and then let me know what you think. All right. So
Sounds
thank
good.
you so much, Dr. Joy, for your time and really your patience for explaining stem cells. I've done podcast episodes on stem cells before, but it's so complex and it's great actually to hear different opinions and bring it all together. So thank you for your patience in answering my questions. And I hope to see you again to talk about core cells. It's like so many other things I want to talk to you about that comes from your clinic. The name of your clinic, by the way, what is it?
It's called Chara Health. So Chara, Chara Health USA is in Los Angeles.
Oh, I have that. Sorry, I do have that in the
Yeah.
show notes. It's
But
in
we do see people from all around the country, all around the world. We even do concierge services where we can deliver our treatments in any place in the US. So,
good to know.
yeah.
Oh, wow. Okay. So wonderful. Well, thank you so much to everyone who's reached the end of the podcast. You're obviously very curious about stem cells, and I appreciate your time. We appreciate you
Yeah. And maybe I want to mention one thing since I know you're a menopause expert, you're all about female health, that we've seen stem cell therapy enhancing fertility. And I've seen that multiple times. The AMH goes up and the hormone level is restored closer to the youthful state, and people actually have more success getting pregnant. So I just want that to be out there.
Oh, okay. So if you're trying to have a baby a little later in life, then stem cells may be the
Yes.
answer.
Yeah.
Oh,
Could
wow.
be
So
helpful.
do you have, you must have a podcast episode on that, don't you? If people learn
Not
more?
specifically. We've talked about it. Yeah. And I mentioned it. I think actually a couple of female doctors I've interviewed, we talked about that.
Oh, okay. There's this next solo episode. All right. Well, thank you so much for your time. And I can't wait to see you again. And good day, good night, good morning to everyone else who's been listening to the end. Take care.
Yes. Wonderful talking with you, Zora.